Let's tell you that in a bold move to tackle the nationwide Japa syndrome and improve healthcare delivery, Governor David Nwifuru of Ebonyi State has announced a Stay and Serve initiative. The governor said the program aims to incentivize doctors working in the state's general hospitals by offering a monthly 150,000 naira relief allowance on top of their regular salaries. During a meeting with the Ananda Marga Universal Relief Team Foundation, Governor Nwifuru stated that the initiative is a demonstration of his administration's commitment to providing quality healthcare services to all Ebonyi citizens. He explained that the allowance will help doctors fuel their new cars and offset other sundry expenses, ultimately improving their quality of life and reducing the urge to migrate. Joining me on the news to discuss this development on a nationwide scale and how it impacts the welfare of doctors across the nation is Dr. Ofonere Chukwunonso. He is the President, Association of Resident Doctors, Esut Park Lane, and a Senior Registrar at the Department of Obstetrics and Gynecology. Thank you very much for joining us. What is the current welfare situation of doctors in your state? Is the news an exaggeration or it is what the governor said?
Okay, thank you for having me. Actually, the news is for Ebonyi State, but I'm the president of Association of Resident Doctors, Esu Teaching Hospital, Park Lane, which is in Enugu State. So we received the news from Ebonyi State as a good one. However, in my state, Enugu State, there are also some welfare packages that our governor, Barrister Ndubisi Mba, has also initiated to help doctors to stem the problem of brain drain, and that includes the issue of medical residency training fund, which is a training fund to assist resident doctors in writing their exams. Is a kind of a fund that is released to doctors that are going for training, that are into training, to help them in their exams, because we write exams in West Africa and the national exams, and these exams runs in millions. So our governor has approved that welfare scheme for us, and some other things that are also like palliative or hardship allowance for doctors, even though our house officers are not benefiting from that, but we hope that very soon they will be part of it. So these are the basic ones that are currently ongoing. However, we are still discussing the issue of housing loan and car loan for doctors in Enugu State. So we believe that very soon that our governor will look into that, and we approve that for doctors in Enugu State so as to reduce the menace of brain drain. Thank you.
What kind of impact could a program like what you have in Ebonyi and what you're saying is happening in Enugu have on stemming brain drain if implemented, maybe on a national level? Some of the things you're enjoying there moved to other states and replicated, and what Enugu State, Ebonyi State is also doing replicated. Could incentives like maybe monthly allowance and cars only impact retaining doctors?
Okay, yes, it has a lot of impact, in the sense that it will encourage the doctors that are still in Nigeria to remain, because if you go outside, actually, what are the driving factors on brain drain in Nigeria is poor welfare. So if the current governors, especially in the Southeast, have initiated the process of better welfare for health workers, I think it goes a long way in impacting the health system, in the sense that you have more doctors to be on the ground to take care of the patients in the state. And also, there is motivation. The doctors are motivated to work with their heart and to take care of their family, because you can't be working and you are thinking of the welfare of your family. You will not give the best to your patient. So I believe that it has impact on patients, it has impact on doctors, because psychologically you work and you work with a better mental health and other things. So it has a great impact on doctors and on patients and healthcare in Nigeria in general. So we encourage other governors to learn from these governors, the Ebonyi State governor and Enugu State governor, to help stem the issue of brain drain in the health sector.
All right, Doctor, thank you very much for speaking with us. We appreciate your time.